to J.parry Clinic. We have a very snowy day today, about 14 inches outside. But today we're going to talk about a really exciting procedure we offer here. It's called NeoGraft. A NeoGraft is a minimally invasive hair transplant system for restoring hair that has fallen out. Unlike the old traditional methods where we would take a strip of hair from the back of the head and then remove the hairs and then implant them, the NeoGraft, we individually take the hairs from the back of the head and move them to the areas that require more hair. The advantage of the NeoGraft is there's no need for incision, there's no need for surgery, and you will not be left with a scar in the back of your head. Oftentimes we've seen people walking through the mall or a friend, and you'll notice that a long line across the back of their head. That's a dead giveaway that patient's had a hair transplant. So the NeoGraft completely avoids that by individually taking the hair and not doing a strip. Those hairs are then implanted to the appropriate area. It's a very pleasant procedure. We do it right in the office with a little bit of sedation. Depending on how many grafts you need, it's anywhere from 4 to 6 hours in length. We normally stop and have some lunch. You're able to get up and go to the bathroom and listen to music or whatever you like to do. There's no scalpels and it's all minimally invasive. About 95% of the NeoGraft hairs that we transplant will stay, and these hairs will not fall out like the hairs that originally fell out. The reason why is that hair comes from the back of the head, which is programmed genetically different than the hair on the top of the head. In addition, often to NeoGraft, for people who are not quite ready for a hair transplant, we do offer some other injectable procedures to try to maintain the hair that you have to keep it from falling out. So if you have any type of hair loss, even in the very beginning stages or more in the advanced stages, I would recommend you come by for a free no-cost consultation where we can determine whether non-surgical techniques could be used or surgical techniques. Okay, so now we're back. We have our patient in the room. He's already undergone a little bit of a haircut. We just shaved the back of the head because this is where we're going to be taking that donor hair. As you remember, I said this hair is genetically different than the hair on the top of the head. It will never fall out. You'll never see anybody without some hair in the back and on the sides. So we just shaved the hair here. We've injected him, and we're going to get ready to start harvesting the grafts. Okay, so now we have Daisy here as one of my technicians, highly skilled in hair transplant. So what we're going to start doing now is we're going to individually remove those hairs with this little machine. Essentially what it does is we just punch out the entire hair in the hair follicle. As I had mentioned there's no surgical incisions, and there's not going to be any evidence once we're done of the hair we removed back here. It'll heal 100% normal, and there'll be no evidence that we ever took any hair from back here, unlike the old traditional strip methods where you would have a scar all the way across the back. So we're going to take about 2,000 grafts this way. Now people always ask, well, am I going to have a bald spot where we're taking the grafts? No, you will not. We space out the grafts and we take about no more than 15% of the hair back here. That's why there'd be no evidence after 2 or 3 weeks that we ever took a single graft from back here. And the hairs are actually being sucked up through the machine and into a canister. And once we harvest all our hair, then we'll go, in the follicles, we'll go ahead and we'll cut them and sort them out by size, and then we'll start implanting them. Okay, you can see Daisy is continuing to harvest the little hair follicles. She uses magnifying glasses to help her see. It's very important that when we harvest them, we come in at the right angle so we don't transect the hair follicle. Unlike the robotic machines, there's a lot less chance of transecting the hair follicle when you do it by hand like Daisy's doing. So this will take a little bit of time, and we'll harvest those 2,000 hair follicles. And when we say 2,000 hair follicles, a hair follicle can have anywhere between 1 and 4 hairs. So on average, we're transplanting anywhere between about 2,000 to 7,000 hairs with 2,000 follicles. Okay, so we've already harvested some follicles, and Daisy is over here preparing the follicles for the implant. So I'll let Daisy tell you what she's doing.
I am sorting them by the single hairs. Like this one has 1 hair. You can see that. This one has 2. I'll try to find one with more than 2. Here's one. This one has 3 follicles, if you can see that. So I sort them by single grafts and then multiples of 2 and 3.
So why is that important? So the reason why it's important is we want it to be a very natural appearing when we do the hair transplant. So the single grafts, so the ones with single hairs, are what are going to go up in the front few rows to make it look very natural. The grafts that have 2 or 3 hairs are going to go further back because that's how the hair is normally on her head. So Daisy's sorting those all out, so when we're ready to start implanting them, we'll have them sorted out. If we don't have enough single grafts, then we can cut the double grafts down to single grafts. Okay, so at this point we've finished harvesting all the grafts, and you can see, taking a quick look down here, that's hardly even noticeable where we took the grafts. There are tiny little holes where the grafts came out, and over the next week those will close up. And in about 2 weeks it'll be hard to tell what we did. Chantal, any comments?
Well, we don't harvest over 15% of what's in the back. That way when the hairs that are left grow back in, you won't be able to tell that we took anything. So these holes will close up in a few days. And we just put triple antibiotic ointment over it just to help the holes heal faster. So now we're just gonna wrap the back up just to put some pressure on the little holes in the back. And we're gonna flip them over and start the next part.
So now we're ready to start taking the grafts that we've already harvested. They've all been sorted to the proper size, and now we're going to start implanting them. So as you can see, we've already marked out where his new hairline is going to be, and let the patient make sure he's happy with that. Can you hold the mirror? And we're going to bring it back. And then this is the area where we're going to be implanting the new follicles.
Yes.
Because this is the area that he's concerned about. So let's make one adjustment. So I think this will be just a little bit sharper. You know how it kind of rounds? A little bit sharper. That's all. That's it. Okay, so we've finished the procedure and we're getting the patient ready to go home. We're going to be putting a little bit of a head dressing on him to hold some pressure where we took the grafts. He's going to keep that on for about 48 hours. He's going to take it off and then start doing his post-operative care. He's not going to get any type of water on where we put the implants for about 4 days, and then after about 7 days he can go back in the shower. Won't let him exercise for about a week to 2 because we don't want him sweating, and otherwise he'll be able to go back to work in as short as 2 days. So that's the advantage of the NeoGraft system being non-invasive. So how was it overall?
Good. Pain, you know, a little bit of pain, but otherwise good.
All right, awesome. Well, thank you for coming by today, and we'll see you back in follow-up.
Thank you.